All right, so this video I think is pretty important because here we are in the thick and thin of things, meaning we are in open enrollment. And what that means is people can change their prescription drug plan and they can change their Medicare Advantage plan. A lot of people during this time think to themselves, hey, I'm spending a lot of money on my medigap plan. And I'm seeing all these commercials. JJ from Good Times, I'm seeing Joe Theismann, all these football, quarterbacks and so forth. You see all these commercials and you're thinking to yourself, hey, they're talking about this Part B premium give back. They're talking about zero premium plans, all of these different things. It covers vision, dental, and hearing and prescriptions. So many of you are wondering, should I stay with my Medigap plan or should I leave and go to a Medicare Advantage plan? That's probably the biggest question that I get during this time of year. And the thing is, a lot of times when someone is turning 65, it's a no-brainer. For their gap plan, they're paying most likely, if not definitely, under $200 a month. And they can do everything with that. So if they're really sick or whatever the case may be, there's no way that they're going to, if you have a G plan, let's say, and it's $150 a month, there's no way you're going to spend as much as if you were in a Medicare Advantage plan. But here's the real kicker, and here is the question. And I have called numerous companies because I'm kind of getting tired of being ignorant to the fact of what's really going on. And some of the plans out there have some great customer service reps that I've spoken to and done my homework on certain plans that I have brochures and everything. So I've been sitting here for the past couple days digging into this. Now, here's the thing. So some of the companies, now this is different from state to state, city to city, and zip code to zip code. So Medicare Advantage is really confusing. The Medigap plans are easy. You can be an agent sitting in Texas and have people all over the country in Minnesota and wherever it may be, Florida or California, and a G plan is a G plan. I'm living in Florida here. I used to live in Pennsylvania. I go back and forth between the two. I'm licensed in many different states. I talk to people throughout the country about their gap plan. It's very easy. I just look up what the price is and I say, hey, this is the price of what it would be, but it's the same G plan as anyone would have throughout the entire country. Same thing goes for any of the Medigap plans like the N plan or the high deductible G, F, and so forth. But with the Medicare Advantage plans and the prescription drug plans, that's a whole different ballgame. They are all over the place. So in this video, I kind of want to address that. So since I told you I'm from Pennsylvania originally, I'm from Philadelphia, hence partly the bad accent. I don't think it's that bad. Some people say it is. But in Philadelphia, there's a Blue Cross plan that some of my clients are on. I don't know the percentage, but I just want to say like maybe 10%. And the reason that they're on this plan is I've had clients that were paying over $500 a month for their Medigap. At the time, it was probably F and so forth. And they said, hey, I'm paying $6,000 out of pocket for this plan. Let's say they were paying $550. Believe it or not, I did have people that were paying that much. I still have people paying that much. And they said, I'm paying $500 a month for my Plan G or Plan F, whatever it was. I have my prescription plan. That's like $30 a month, maybe if they, whatever it was, plus the copays. And then they might have been on a vision, dental, and hearing plan that was an additional $40 a month. So we're talking $650 a month for their entire plan. Now, when I went over, because Blue Cross is such a big player in the Philadelphia area, now I don't talk about Medicare Advantage plans throughout the country because, like I said, they're so complicated. I'd have to dig into the plans. A lot of times my clients that are in different states, I just basically put them on the gap plans. But for this particular, I've seen Blue Cross for the past 15 years. I've been to all their meetings when I lived in Philadelphia. I know most of the people that work there, and I've spoken to the customer service reps for the agents now for years, and they keep the same people. So here's the thing. If you have one of these plans that's a PPO, a lot of times the max out of pocket is $7,550 for 2023, let's say. The out of network out of pocket might be 10 grand. Now, if you live in a certain area We'll just take Philadelphia, one of the 5 counties. You might live in the suburbs. The max out of pocket for in-network $7,550. Still have a PPO plan, but if you live there and you don't travel that much, or maybe you travel a little bit, but you're using all of your doctors in-network and all the hospitals. I spoke to them today. A woman told me over 83,000 doctors are in the network and such amount of hospitals. I mean, I shouldn't say most, a lot of the hospitals there are in network when I look them up. So someone would be paying close to $7,000 for their gap plan and everything up front. And yes, there would be no co-pays, or there would just be that deductible for $233 in 2022 for the Part B deductible. After all this said and done, they are going to be paying over $7,000 for everything that they have. And they want to take a look at this PPO plan because it's pay as you go. So there's a chance that they might not reach that max out of pocket. There's a very good chance. I've had people switch where they're saying, this is unbelievable. I'm going to the doctor a lot, but what I'm paying is, at the end of the year, $3,500, maybe at the most $4,000, whatever it is. So it's on almost half. So they get a bad rep about this. But here's where I'm the difference that I have seen. If people say, what would you do? It's never one or the other. But from what I've seen, it's over the past so many years. When you're first getting on Medicare, you get on a gap plan. If you have the money, what most people will do, they get on a gap plan. It might cost them $150. Then they get on a prescription plan. It might be $5, $10. It might be $30, whatever it is. Then if they want to get a vision, dental, and hearing, a lot of people say, hey, my dentist doesn't take anything. I'm not getting that. But even if they do, they're going to be paying less than $3,000 a year up front for everything, and it's going to be the best coverage that they can possibly get. An example would be, I've had clients of mine that went into the hospital. I had one client that had a stroke. This is years ago. Went into the hospital. They sent her off to a rehab center. She was there for a month. She went back to the hospital, then went back to the rehab center. I mean, it was horrible. She really had it bad. She ended up passing away a few years later. She was a good friend of mine. She had been my client for a while. But from what she was paying to what she would have paid for the rehab and all this different stuff, it was well below what the max out of pocket for that Advantage plan at the time. This is because she was less than 70 years old. But if she was 80 years old and did the same thing, the cost of that gap plan and the cost of the Medicare Advantage plan. So say the gap plan was $500 a month for if she was on it for 80 years old. And there's a reason why you would be paying that much. And most of the agents know it's because you weren't able to switch your gap plans and save money throughout the years. Maybe you were sick from the time you were 68 or, whatever it was, and you weren't able to switch, and all those years went by and you were paying a high premium for your gap plan. If you're healthy, you can go in and out of gap plans and save money every year. I have some clients that switch every 2 years on, right on the 2-year mark, and they save, maybe $40, going to another plan. But some people can't do that. So if she was 80 years old or 76 years old and she was paying that $500 a month, and she had this Medicare Advantage that was paying for this, paying for that, you have to look at the total out of pocket for the year. If it's even going to come close to that $7,550, you should check out the Medicare Advantage. If it's not going to come close, then a lot of people don't want to. But it's very hard for agents to pinpoint and say, these suck, these are great. I've been trying to do that for years. I've been, playing ping pong. And one thing that I noticed is when you first start to become an agent, obviously most of your, actually, I shouldn't say that. When I started, I was concentrating on people turning 65. So maybe the first, second, third year, whatever, all of my clients were 65, 66, 67, in that age range. So their gap plan was very cheap. What happens is over the years, I don't know about every person that does this, but over the years, of course, this one has a cousin, and this one has a brother that's 5 years older, and this one's mom wants something or whatever. And so the ages start going all over the place instead of just in that lower range. So then people are like, hey, I want to think about these Advantage plans. When I was younger, I would say, oh no, I only do these. I don't deal with the Advantage plans. I've heard some bad things about them and so and so. But then some of my clients say, hey, I want this. My neighbor has it, exact same age, exact same whatever. They did this. I want it. So I said, okay. I always took my exams for the test, so I put some people on it. Then I started to see, oh, they were happy with it. Okay, let me talk to some other people. Here's, another choice. So it's really hard to make a decision on what the best thing to do. But the one thing you can say is the max out of pocket really tells the story. How much are you paying for your gap plan per month? Times that by 12. Okay, it's this. Add your prescription drug plan, add your vision, dental, and hearing. And that's what you're basically, if you have a G plan, add, 226 or 233 to it, whatever the Part B deductible. And that's your max out of pocket. Then you go over to the Medicare Advantage and you look at that and say, it's very simple. They have max out of pocket, a number sitting right there. It's not what it's not just the cost per premium per month. It's a number, max out of pocket, $7,550. Take a look at both of those numbers, what you would be spending on your gap plan plus prescription and vision, dental, hearing. Then your Medicare Advantage. Look at the two. Say, hey, maybe I want to take a chance with the Medicare Advantage because maybe I'll pay less. There's all these ins and outs, but this is what agents do. They look at different things and they say, oh, no, you want to stick with this. Some agents, if they have a lot of clients throughout the entire country, just say, you know what, I'm not dealing with Medicare Advantage. They change, all the time, and it's different everywhere else. And they might have so many clients throughout the entire country, they don't want to deal with them. I don't blame them. It's there's a lot of ins and outs that go along with that. I just so happen to have a ton of clients in a concentrated area because I live there. And that's, for so many years, I had so many clients in these areas. And I built up, hundreds of these clients in a concentrated area. Then I started branching out to different states and so forth. And then, of course, I moved. So there's like certain states where people ask about Advantage plans as opposed to others. And one of the states, where I come from Pennsylvania, I have a lot of friends that are agents there and so forth. And I've asked them about these certain plans. And so it's different, when you're in a concentrated area. That's the best that I can do for you. It would even be simple if I talked to somebody from a specific area and I looked at the Medicare Advantage plans in that area and I was able to decipher it. Now, I just got off the phone with somebody who was going over different things with me. And immediately what I do is I call up that specific company and say, hey, here's my questions. What's going on with the Medicare Advantage? The gap plans are easy. That's, if we could all just do gap plans and have all of our clients and the prescription plan was included with the gap plans, then our lives would be completely simple. But just so happens the prescription plans are not. So around this time, most of the gap people want to look at the prescription plans, and that's a whole nother thing in itself. Hey, I hope this video helped. I will keep doing some of these videos. The reason why I did this right now is I just got off the phone with this company and I thought, let me throw something up there without editing it. Hopefully the information gets out there. If it helps somebody, great. Thanks for watching the video. I'll see you at the next one.